the cuts to Medicaid, which I'll get to in just a moment, but and as well as the ACA, they don't go into effect until after the midterms. So let me just ask a question. It's more of a political question than an economic question, but it is relevant. Is the assumption here that the Republicans can push this through now into law? They can wait until after the midterms, and then by the time that these destructive cuts really take into effect, that they can just propagandize around it to shift the blame into other places other than their own legislative record? Is that a fair reading?
I expect that that's what they're going to try to do. I mean, they're denying their cuts, and again, they're not being subtle. Speaker Johnson was saying there are no cuts to Medicaid. President Trump said there's no cuts to Medicaid, and you wrote down we're going to spend $800 billion less on Medicaid. How do you get that with no cuts? So my guess is that they're going to do exactly as you say. They're going to say, "Oh, nothing happening, nothing happening." Now, again, whether the Democrats let them get away with that, you get into some fuzzy territory, obviously not my area of expertise, but people are losing benefits all the time. And one of the issues with Medicaid, of course, is a program run by the states. One of the issues really forever has been the leeway of states to throw people off. The Biden administration had been trying to limit that, to say that you can't just throw people off you don't like, or they didn't fill out a form the right way or whatever. So they were trying to enforce, in effect, what we might say was the intention of the law. The Trump administration is not doing that. So my reason for saying that is we're going to have people thrown off in 2025, 2026, even if it wasn't directly because of the law, but it's because of the Trump administration not trying to prevent states that do want to throw people off. Now, whether Republicans get blamed for that, I guess we'll see. But, I could imagine the Democrats certainly trying to push that case. I would if I were them.
Let's talk about Medicaid, because this is one of the sort of central components here. Certainly, rural hospitals are going to be affected. I've seen estimates somewhere between 500 to 800 might close, but of course, any one of them can serve constituent needs in a really important way. So it's a bad thing. But can you talk mechanistically in the language of the now law? You noted that the president and then the speaker are saying, well, we're not actually making cuts, but it seems like what they're doing is just changing eligibility requirements. They're sort of finding new ways in which to not formally say, hey, we're cutting, but the cumulative effect ends up being that. How are they actually doing it in the law?
Yeah, there's several things in there. So first and foremost, they are imposing work requirements. And, it's not a secret here. There's a lot of research on this. The vast majority of people on Medicaid are already working, except obviously for disabled people, elderly people. You have a lot of seniors who are both on Medicaid and Medicare. But the vast majority are already working. And we have had states, Arkansas most notably, that did impose work requirements, and they found it had no impact on work. What it did do was cause a lot of people who are eligible to be thrown off because they make a mistake. They don't fill out a form correctly, or sometimes maybe the government makes a mistake, believe it or not. But the point is, that's how it saves money. Is it gets people thrown off. And it's sort of striking to me that we have an administration that's very intent on reducing the paperwork for companies, saying that this is a big burden. Of course, these companies all have lawyers, and big companies have teams of lawyers. But then when it comes to low, moderate income people on Medicaid, many of whom don't have much education, they have difficulty filling out forms, they're happy to throw paperwork at them. And that's the biggest chunk of it. Now, there's also they're lowering some payments to hospitals. Their complex formulas not worth getting into, but hospitals in general will be getting less money. And that matters. It's a big deal for the rural hospitals because you already have a lot of rural hospitals closing. So it's not 0-1. It's not that if we didn't pass the bill, there'd be none closing. We do pass it, we'll have 500 or whatever the number might end up being. But the point is, we're going to see a lot more because they're getting lower payments. You have a lot of hospitals who are just on the edge. You cut their payments from the government by 10, 20%, what you're doing here. So many of those are going to go under.
Can you explain to me what the provider tax is and what this law will do to change it?
Yeah, so the provider tax was kind of a backdoor way for states to get money for hospitals, that they would impose a tax, Medicaid would pay it, and they would give it to the hospitals. And this cuts that payment substantially. I don't have the exact number at my fingertip, but it's much lower as a result of this bill. So again, that's a source of money for, rural hospitals in general, but it matters most for rural hospitals. And they'll be getting less money. And again, many are already closing. This will increase the number that close.
As an economist, are you able to speak to what, and again, this is it's hard to know exactly how it will all play out in the end, but do you have is there any economic theory about what happens downstream from a situation where, again, 17 million people, again, accumulatively over time, lose their health care? What happens to the economy as a consequence?
Yeah, there's several issues, and it's hard to get to our precise numbers, but we can tell general stories. So one thing is we know people will be in worse health, and that affects the labor market. Again, you have a lot of people with chronic conditions. If they could have those treated, diabetes is a great example. You have a lot of people with diabetes. If it's treated, they could function just fine. If they can't afford the treatment, if they can't get insulin and other treatment, they'll just deteriorate. I mean, some may die, but they aren't going to be able to work, so their condition will worsen. So you'll have a lot of people like that they have more expensive conditions. Will the government pay for it? Will emergency rooms pay for it? I mean, we'll have to see, but it's a cost to their health and it's a cost to the economy insofar as they were more expensive care for in principle, very treatable conditions. And then on top of that, we might lose them in the labor force. There's another story that is, I think, underappreciated, but it's well documented, that Medicaid, I don't have the exact number, but around a third of the people on Medicaid are kids. And if kids don't get good health care, they don't do as well in school. They don't subsequently have as good jobs, good work histories. We pay for that. So that's a longer term story. We aren't going to pay that for next year. But if we look 10, 15, 20 years out, we're going to pay a cost on that. And we're going to have a lot of kids being raised in lower moderate income families that won't have what they need to succeed.
In such as I understand it, so I'm just trying to process all of this. But for removing people from the rolls, there is no savings to what they're proposing?
There's no substantive savings. You have to go through there and say, is there something that they're actually saving money on? Nothing that I'll put this way, nothing that has gotten a lot of attention. And certainly if they could identify a clear area where they have savings, I'm sure they would be happy to tout it. So I've been following what they've been saying, and I won't say I've read through everything in the bill, but right. If there's an area where there's big savings, I think I would know of it, and I surely don't. Again, other than throwing people off the rolls,
nothing meaningful beyond that. In other words, right?
That's exactly.
Yeah. Okay. In terms of SNAP, which is one of the more interesting parts of this conversation as well, it seems like they're employing a similar kind of mechanistic way of doing this, where again, are we cutting SNAP? No, not in that way. What they're using is the same kind of Doge logic. We're going to find waste, fraud, and abuse. Could you explain to the folks who might be listening here or watching, what are they doing to SNAP, and mechanistically, how are they achieving that?
It's the same sort of thing. It's primarily work requirements. And again, the assumption is that, they're saying, again, they want people to work. The vast majority, and again, this is well studied, the vast majority of people getting SNAP benefits are working, except for those who have young kids that they're caring for, people who are disabled. But you exclude those people, the vast majority are working. So again, it's a work requirement, and they could say we're not throwing anyone off, just go to work. They are working, and so it's the same sort of, to my view, very dishonest thing. I should also point out, because one of the things that, going back to Medicaid, one of the things that's come up with a number of the supporters of the bill, they're saying, well, they'll go to work and then they'll get good insurance through their employer. Actually, somewhere around a third of employers don't provide insurance. And the reality is people who are on Medicaid are the ones most likely to be working jobs that don't provide healthcare insurance. They're going to work at a convenience store. They're going to work at a restaurant. Those jobs generally don't provide healthcare insurance. So if they're not getting through Medicaid, they're probably not getting it.
Hey guys, thanks for watching the video. Please consider giving this a thumbs up as well as liking it. And if you want more of my politics coverage, go to the link in the description box for my Substack. Yes, go to my Substack. We might put a QR code on the screen here as well. Tons of exclusives, interviews, chat functionality with a whole different community over there. Tons of fun stuff. Give it a look.